Okay. So role is there like a mental. You are the mental health nurse in the mental health clinic, and they have given the background like you are seeing Mr. Adam Benjamin. So the patient name is Adam Benjamin. A new patient presenting with a possible PTSD symptoms. And our task. What are the tasks which is included? Like ask question. Uh, ask question to gather a detailed history of Mr. Benjamin's symptoms and their impact uh, on his daily life. Okay. So you need to first ask is you need to what so before that what is PTSD post traumatic syndrome? Okay. Syndrome like depression. Okay. In the task, it is given that ask question to gather a detailed history of Mr. Benjamin's symptoms and their impact on his daily life. So you need to ask regarding symptom. Then next task, evaluate the severity of Mr. Benjamin's symptom and risk factors for PTSD. So regarding the risk factor, you need to frame a question and you need to ask to the patient, and also severity of you need to assess the severity of Mr. Benjamin's symptom through the questions. Okay. So the next one, explain PTSD. So in a simple way, you can explain what is PTSD. So it's a mental health condition triggered by traumatic event causing flashback, severe anxiety. Then discussing symptoms. What are the symptoms? Flashback, nightmare, avoidance of trigger, negative change in mood, hyperarousal, so heightened startle response. Then what are the causes and potential treatment like CBT, like cognitive behavioral therapy and medication, antidepressants, supportive group for coping healing. So these are the treatments. So they have already given hint related to the definition of PTSD and what are the symptoms, then what are the cause and treatment. All these data they have already given in this point. So based on this point, we need to frame the question and we need to ask to the patient. Okay. Then next task, explain different evidence-based therapy for PTSD. That is regarding the group therapy and what cognitive behavioral therapy, all those details you can explain to the patient. Next one, inform Mr. Benjamin about available support group. So in that available support group, you can share that information regarding that nearby support groups are available. I will give you some kind of contact number to you. In that way, you can handle the patient. If point like this, like online resources, community services, they can offer additional support. And the last point is listen empathetically to Mr. Benjamin's concern and reassure him that effective treatment is available. So patient is very concerned about their symptoms. So you need to listen empathetically and reassure the patient. How we can reassure, like we are here to help you, or we have um, well-known therapists are there. So through the treatment, you will be recovered soon. So in that way, you need to reassure the patient. These are the tasks. So we can see a sample answer also. So in so we know that our patient name is Mr. Benjamin and the diagnosis is PTSD, and in the task we need to explain regarding the diagnosis and causes. We need to know the cause and we need to know the patient symptoms, and we need to explain the treatment and we need to reassure the patient and we need to give that we need to give more detail about that support available in the near area. These are the tasks we have already saw in the speaking part. So based on that, I have prepared some sample speaking. You can see that. So as a nurse, how you will initiate the speaking? Like when you saw a patient, first you need to greet the patient, right? So how? So good morning, or good afternoon, or good evening, Mr. Benjamin, or good morning, Mr. Benjamin. In that way, you need to greet the patient, and then you need to what? You need to introduce yourself. You need to tell your name. Myself, or my name is X, and I'm the registered nurse, or I am the licensed nurse working here, or I am here to help and support you. How are you feeling today? This is how we are initiating our speaking. So how are you feeling today? So the patient reply must be hello, no, hello. I'm not doing well. I have been a tough time lately. So patient is not doing well. Okay. So patient is telling a negative or sad news that I am not doing well. So after hearing a sad news, what will be your reply like? I am very sorry to hear that, or I am sorry to hear that, Mr. Benjamin. To better understanding your situation, could you please share with me the recent traumatic event that has been affecting you? So you have so you need to know more about the patient condition. For that, you need to ask like to better understanding or to better understand your situation. You could you please share with me the recent traumatic event that has been affecting you? So patient will tell you all these details. So here it is mentioned that they have involved a car accident, and after that only patient has gone this kind of symptom. So after giving or explanation from the patient side, so you need to appreciate the patient, because it is very hard to share all this information from the patient side. So patient has share their very like all this information to you. So you need to, as a nurse, you need to appreciate the patient. Like I appreciate you opening up about that, Mr. Benjamin. It sounds like you are experiencing symptoms consistent with the PTSD. Can you tell me more about how this has impacted your daily life? So our next task is we need to know how the symptoms has impacted the patient daily life. That's why we have framed the question like, can you tell me more about how this can you tell me more about how this has impacted your daily life? This is one of our tasks. So patient reply must, sure, I have been I have been having this flashback during the day, and the nightmares make it hard for me to sleep at night. I get anxious and try to avoid driving or even being a passenger in a car. I'm also avoiding places that remind me of the accident. So based on this answer, you need to continue our speaking. So patient is giving information, so you need to tell me, you need to tell that I understand and I am appreciating you sharing that information. It is important for us to explore your symptoms in more detail. So you need to ask some more questions regarding the condition. That's why we have added this phrase like, it is important for us to explore your symptoms in more detail. So we are asking for the severity. So on a scale from 1 to 10, with 10 being the most severe, how would you rate the impact of these symptoms on your daily life? So we are given a scale from 1 to 10, scoring from 1 to 10 to the patient. So asking the patient to rate their symptom impacting on their daily life. So patient will rate you the with that. It is like 8. It is affecting my work, relationship, overall the well-being. So again, you need to patient is sharing the information. So thank you for the sharing that, Mr. Benjamin. It helped me understand the severity of your symptom. Now let me explain a bit about PTSD. It's a common reaction to traumatic event and can affect anyone. So we are explaining regarding the PTSD. Symptoms you describe. So based on the symptom which have already explained by the patient, like flashback, nightmare, avoidance are typical of PTSD. The good news is that effective treatment are available. So we are like assuring the patient that treatment is there. Okay. So the patient side, that's good to know because we are telling a good news to the patient that treatment is available. So what kind of treatment are for PTSD? So patient is eagerly asking for, okay, the what kind of treatment are there for the PTSD? So patients from your side, you need to explain more regarding the treatment. Like there are evidence-based therapies such as CBT. We have already explained the cognitive behavioral therapy is there, and eye movement desensitization and pre-processing. The therapies aim to help you process with a traumatic event, developing coping strategies. Okay, all these details you can explain in a simple language. Only you can tell to the patient that CBT, it is a group therapy, sorry, it is a behavioral therapy, and through this therapies your symptoms will be recovered very soon. Also, in addition, medication also available to be considered. In some case it is essential for us to explore which approach might work best for you. So that also we need to add to this. Okay. So the patient side will be, I'm willing to try anything that help me to get through this. What about supporting group or additional resources? So patient is asking about the support groups and additional resources. So as a nurse, you will tell, I'm very happy to share you that regarding the support group or absolutely, Mr. Benjamin, there are support group. You can see that there are support group where you can connect with others who have experienced similar traumas. Additionally, there are online resources, community services that provide valuable support. I will provide you with a list of available options to explore. You have already explained some of the point, and in the concluding, you have telling to the patient that providing you with a list of available option to explore. So patient will thank you nurse. I appreciate your help and guidance. It is reassuring to know that there are options for treatment and support. So we need to conclude our speaking, right? So we have already completed our task. So when you are concluding, you can tell you are welcome, Mr. Benjamin. I am here to support you every step of way. If you have any concern or question, please feel free to share them with me. We will work together to develop a personalized plan for your well-being. So this is how you need to conclude the but conclude our speaking. So I hope you have understood regarding the speaking.